If you're HIV positive or have an STI, having unprotected sex with multiple partners puts them in grave danger. You'll expose every partner and their present and future partners to HIV or another STI. Use a condom every time you have sex. You can live a productive life even if diagnosed with HIV. Remember, early detection is key to your survival. Be responsible, protect yourself and others. Help stop the spread of HIV and other STIs.
There are some.
Is on.
Good day and welcome to another National Emergency Operations Center COVID-19 weekly briefing for the 2nd of December 2020. I am Les Roy Williams. Can't believe that we're already in December. Time really flies. But thank you for joining us, and we continue to provide you with information with respect to the COVID-19 pandemic and the management of it here in St. Kitts and Nevis, which is so important to the health and safety of the entire society, the all-of-society approach that we have been preaching as the gospel, really, in the book of COVID-19. Today, I would like to invite, firstly, Superintendent Cromwell Henry, Divisional Commander for District A, to give us his presentation. Superintendent.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening this broadcast by whatever medium. Now, this afternoon I want to spend a little time in my presentation speaking to events. This has been a very topical subject in recent times, and so just want to spend a little time speaking to the topic. Any decision to hold an event during the COVID-19 pandemic, no matter how large or small, should rely on a risk-based approach. The World Health Organization has provided guidance on how such a risk-based approach can be taken. Precautions to consider include actions to prevent transmission between people and where to hold the event and how it can be modified to make it a safer environment. Canceling a planned event is an option that should always be considered, especially in a case of non-essential events or when precautions cannot be implemented or adequately communicated. A gathering refers to a planned or spontaneous event, indoors or outdoors, with a small number of people participating or a large number of people in attendance, such as a community event or gathering, a concert, festival, conference, parade, wedding, or a sporting event. The more people an individual interacts with at a gathering, and the longer that interaction lasts, the higher the potential risk of becoming infected with COVID-19 or COVID-19 spread. As mentioned in the previous presentation, permissions to host social events, particularly the larger ones, will be very limited, if at all. We ask that organizers first seek permission to host events before advertising same, even if it is just a permission in principle. It causes much public disquiet when events are advertised and persons purchase tickets or incur costs to attend, to be told that the event was cancelled by the organizers because of a lack of permission. We also want to bring to your attention those vendors who are accustomed to ply their trade in the downtown Bastille area under permission granted from the Carnival Committee, that this year things will be different. As we try to get through this period of pandemic, the Carnival Committee will not be granting any license or permission for vendors to set up their trade in the downtown Bastille area. The Commissioner of Police would be the sole person responsible for granting permission for use of the public spaces, and so we ask persons who may require such permissions to apply to the Commissioner of Police rather than the Carnival Committee. As there will be no street activities, again, these permissions is likely to be very limited, and so we ask persons to be guided, and we seek your full cooperation. Thank you.
Thank you, Superintendent Henry. I now invite our Medical Chief of Staff at the Joseph N. France General Hospital, Dr. Cameron Wilkinson, to give us the Health Emergency Operations Center situation report. Dr. Wilkinson is filling in for Dr. Hazel Laws, our Chief Medical Officer, who is not here today.
Thank you very much. As you heard, I'm filling in for Dr. Laws today, but I want to start off by acknowledging Dr. Hazel Laws, our CMO, who was very active in getting this presentation together, along with Dr. Rafael Rosales, the epidemiologist, and Dr. Marissa Catty. They were the ones who were responsible for this presentation. Now, to date, the Federation has a total of 22 cases, 16 in Nevis, 16 in St. Kitts, 6 in Nevis, and that brings our rate of infection to 41.3 per 100,000. Because we have a very small population, every time we have 1 or 2 cases, it will increase our infection rate. However, what the CDC and the World Health Organization look at is the rate per 100,000 every 1 to 2 weeks, and that rate for us is very low. But we just wanted you to see the numbers that we have over the last 8 months of this pandemic. Globally, the virus continues to spread, and to date we have over 63 million confirmed cases globally, with 1,469,402 deaths. In the United States of America, just north of us, the virus continues to spread there also, and actually every state now there is considered a hotspot with over 13 million confirmed cases, and to date 270,643 deaths. Actually, yesterday they saw their worst day since the pandemic, with over 90,000 persons hospitalized from COVID-19 and over 2,600 deaths. And today, so far, you have about 1,300 deaths so far, and the day is not over as yet. So those of us who are here living in this bubble and thinking that the pandemic is over, it is not over. There are a number of countries around the globe that are still struggling with the pandemic. In the CAFA region, we have over 61,000 confirmed cases with 1,294 deaths. And in the Caribbean at large, we have over 291,000 cases and 5,146 deaths. And I'm happy to report again that St. Kitts and Nevis has not made any contribution to that death toll, either regionally or internationally. We continue to do what we need to do, however, that is testing those persons who need to be tested. And so far, we've tested 4,256 persons. And our positivity rate is very low, 0.4%. Countries should aim to have a positivity rate below 4%, which means that we are doing quite well. We have about 7 tests that are pending. Okay, the number of persons who are in pre-approved home quarantine are 11. Persons who are quarantined in other facilities, 301. And we have 3 persons in isolation. Those were the 3 cases that you heard about over the last week. The number of persons who were released from quarantine, 2,423. And we have 19 persons who are completely recovered. This is Dr. Law's Edu Corner. Can we have the next slide? We always like to update you on the travel protocols, and you can go to www.knatravelform.kn for the information that we give you here. But despite the fact that it's available online, persons always ask questions. And so the next slide, please. We all know that to come into the Federation, you need to submit a negative PCR test, and this is the reverse transcriptase polymerase chain reaction test that must be done by an accredited laboratory. And this test must be submitted within 3 days of travel. Persons ask about whether or not children need to be tested. It's important for you to know that of the 22 cases that we had here, 3 of them were children. And so yes, the Federation of St. Kitts and Nevis require that all children be tested also, and the protocol is the same. The test must be submitted within 72 hours of travel. And of course, these children, if they're coming, they must be accompanied by an adult, because a child will not be able to be quarantined by themselves. And so children need to be traveling with an adult because they're going to have to go into quarantine. As it relates to travelers with special needs, just today I got a call asking about this, somebody who went away for treatment and was coming back. And so if you are a traveler with special needs, it's important for you to contact the CMO's office. You can email office of the CMO at gov.kn. And these persons, we talk about persons with medical conditions, disabilities, etc., who might need special arrangements. Now, by sending your information to the office of the CMO doesn't mean that you would be exempted from quarantine, but we'll make sure that all the safety precautions and any prerequisites that are needed are put in place so that you can be safely placed in quarantine without having any adverse effect on your pre-existing condition. We have said over and over again that it is only through an effective vaccine that we'll see our way out of this pandemic, and the COVAX facility, which is a part of the ACT process involved in getting the vaccine on board, is what is instrumental in helping us get this vaccine ready for the rest of the world. And this is a global initiative that is led by Gavi, the Alliance for Vaccination, and the World Health Organization. And basically, this is a way of pooling the risk, pooling resources together and procuring the vaccine on a global scale and making sure that when it is available, it will be equitably distributed to everyone around the world, because we know that no one is safe unless everyone is safe. And there is no point in us having a vaccine that is available to the first world countries and the less developed countries would not have this vaccine, because the world is so small and there's interregional and international travel. We'll need to make sure that the vaccine is equitably distributed across the world, and that's what the COVAX facility is for. Now, the overall aim was to accelerate the development and manufacture of the vaccine and make sure that it's available. And we're happy that there are 2 vaccines that are going to be having emergency use authorization. So whereas in the past, prior to COVID-19, the vaccine that was fastest developed was the measles vaccine, which took about 5 years, we have been able to have this vaccine coming on board in less than 1 year. So most persons woke up to the good news that there was emergency use authorization granted in the UK for the use of the vaccine that was produced by Pfizer and BioNTech. And this vaccine has a very high efficacy, an efficacy of about 95%. And we can be assured that the vaccine is safe. And so this vaccine will be ready for use in the UK over the next week. The interesting thing about this vaccine is that it needs to be kept at a temperature between -70 to -80 degrees, and so it will require special freezers or being shipped in special containers with dry ice to keep it at that temperature. Once it reaches to the destination, however, it can be kept in the refrigerator for up to 7 days. This vaccine requires 2 doses that are given 21 days apart. So, for example, you might hear a country ordered 40 million doses. That would be for 20 million persons because you require 2 doses that are given 21 days apart. And the vaccine uses an mRNA genetic type coding to prime the immune system. And the person starts to develop immunity about 7 days after the first injection. So we said that the UK was the first to give emergency use authorization of this vaccine, and I'm very happy that the first world countries out of the gates with this vaccine, and very soon we might be hearing about the emergency use authorization in the US also because they have applied for this. And since these are our main tourist sources, the UK, United States, it will be good if they get the immunization before us to ensure that we will be safe. And so the UK, they're going to have about over 800,000 doses available in the first instance. They have ordered 40 million doses, which will be enough for 20 million persons since you require 2 doses. Now, sometimes persons ask, how would one determine who gets the vaccine? It's done on a scientific basis, and basically it is thought that the persons who need the vaccine most, those are the ones who should get it. So the persons who will be greatest at risk are the frontline healthcare workers, and without the healthcare workers, you won't have a health system, and so those are the persons who will be given priority, and also the persons who would suffer most from COVID-19. And we have to understand that although we're speaking about COVID-19, there are a number of persons who have other pressing health matters that they're having to deal with in addition to COVID-19. And so persons with pre-existing condition, the elderly, the vulnerable, those are the persons who would be next in line. So the 3 group of persons who would be getting it, healthcare workers, persons in healthcare facilities, and the medically vulnerable, or persons with significant pre-existing conditions. Some may ask, well, when would we receive the vaccine? We are hoping that the Caribbean will get the vaccine around about March or so. But you never know. These figures might, we might get it before that. Early on, most persons were saying that we would not get a vaccine before the end of the year. And you see within another week or so, the vaccine will be placed in persons, that is vaccination in the UK in the next week. And so maybe the production might be speeded up such that we might get it earlier than March, but that is the predicted time. So, okay, I'm just looking at this slide for the first time. So how can we protect ourselves? Let's put a slide. How can we protect ourselves? We just need to continue doing what we were doing before we heard about the vaccine. And so we need to wear the mask, maintain proper physical hygiene, maintain the 6 feet distance from persons, and also avoid crowded spaces, because we have to understand that if you're in a crowded space, to put it bluntly, you would be swapping air with other persons, and that would increase your risk of getting the virus. And so if you can avoid these crowded spaces, super spreader events, then we can keep ourselves safe until next year, March, when hopefully we will get the vaccine and get us out of this crisis. Thank you.
Thank you very much, Dr. Wilkinson. I now invite Mr. Abdia Samuel, Chair of the COVID-19 National Task Force and our National Disaster Coordinator, to give us his presentation. Mr. Samuel.
Good afternoon, Mr. Williams, and good afternoon to the general public and everyone and all the viewers who are listening and viewing wherever you are. Today I want to bring you another briefing, but before I begin, I just want to highlight that Miss Christmas Jacob, who does the hand signs, sign language, she's not with us today, not feeling well, and I wish Miss Jacob a speedy recovery, and hopefully she will join us again next week. And we also don't have with us Dr. Hazel Laws, who is off for today. So Dr. Laws, wherever you are highly missed. We have been getting a lot of queries in terms of persons completing the online forms and persons also having questions. And I want to highlight the help desk for individuals who may need to have their concerns addressed. So you can either go to the www.covid19.gov.kn website, or you can visit the www.knatravelform.kn. These two sites can provide you with some information regarding to entry and the health travel protocols into the Federation of St. Kitts and Nevis. There is also the health help desk, and there are some numbers that you can call to get assistance with your health and travel protocols. Those numbers are 765-4880 or 765-4095. Again, I wish to repeat, 765-4880 or 765-4095. Again, we are asking persons that when they go to take their test, their RT-PCR test, it must be a reverse transcription polymerase chain reaction. So this is the test that is acceptable, and it must be done 72 hours prior to traveling to the Federation of St. Kitts and Nevis. We are seeing that a number of persons are now becoming more compliant, so they are able to get their flight into the Federation. I also want to highlight another help desk, and this help desk is for tourism, and you can visit the web page of the Tourism Authority at www.stkittstourism.kn/contact us. If you have any questions, any queries, you could always leave your information, complete the card that is there, leave the information, and you will get a response, or you have numbers that you can call in the event that you have any queries, in particular tourists. Now, there has been question about additional quarantine sites, and I am pleased to announce that the Millhouse Guest House at Garvey's Estate has been approved as a quarantine site, and this quarantine site will have 16 self-contained apartments or rooms for persons to utilize. It will have approved security. It has been for 24/7. You must do your 14-day quarantine, and at a cost of $500 US and above. Again, $500 US and above. This is at the Millhouse Guest House at Garvey's Estate in Trinity. The contact information for your reservation, you can call or email Mr. Jeffroy Morishaw at 1-869-660-0195, or email at grantavenue.djm@gmail.com. This guest house should be available to our returning nationals from the 5th of December. In addition to the Millhouse Guest House, we have also brought on board the Birdwalk Apartment Complex, and as you see there, these are self-contained apartments, and there are 10 of them that have been approved. They have all the amenities necessary: television, cable, you have internet, water, electricity, and is also supported by a generator, backup electricity or backup power generators. And also it comes at a reasonable cost of $500 US and above. For this Boardwalk Apartment Complex can be contacted at 1-869-760-7577, and they can be emailed at brapartmentcomplex@gmail.com. Again, brapartmentcomplex@gmail.com. They will be available for service from December the 12th. There will be 2 VAT days, discounted VAT days, that are coming up. That's the 18th and the 19th of December. Businesses and consumers are asked to adhere to the protocols. We have seen some business places that have already begun practicing these protocols, in particular the TDC group of companies, and we want to commend TDC for the adherence to the protocols and their partnership. You saw the queuing of the lines, you saw the sanitization process, you saw the rotation process that took place while persons entered the store, but most importantly, the way persons were signing up in terms of registering the names, so that if we need to do contact tracing, if an outbreak occurs, then we have information to do so. I am appealing to the business places to follow suit and do same. If you need any assistance, please contact the National COVID-19 Task Force for any guidance. I am happy to announce that the hurricane season has officially ended as of the 30th of November. I'm also pleased to announce that the Federation of St. Kitts and Nevis was not affected in any way, shape, or form by any major hurricanes or storms. We would have had 2 systems that would have passed close to the Federation. However, we would have seen some heavy rainfalls. We would experience some rainfall in the Federation, whereby it would have contributed to a land slippage that would have occurred in the Fort Tyson Rise area in Frigate Bay. And the response that was given to that incident was very commendable by all the agencies, inclusive of NEMO, the security forces, and also the Public Works Department. This response is ongoing as the investigation continues by the engineers. The weather for today, tonight will become variable. Tonight is partly cloudy with a 20% or slight chance of light showers. Sunrise tomorrow is 6:25 a.m. Sunset tomorrow will be 5:36 p.m. Thank you for listening, and do have a great evening.
Thank you very much, Mr. Samuel. That brings us to our question and answer segment. The first question: if somebody already had coronavirus infection, will they still need the vaccine? Dr. Wilkinson.
Thank you. The persons who got infected with the coronavirus, they developed what's called natural immunity. And studies have shown that over time this immunity wanes, which means that the response to in the antibody production drops over time. This is a new disease. Prior to December last year, we knew nothing about COVID-19, and so it has only been studied for less than 1 year. We also know that there were 1 or 2 persons who had COVID-19 who were reinfected. And basically what the science is telling us then that you are not totally protected or have lifelong protection from getting the COVID-19 disease. And so the simple answer for now is yes, even if you were infected, when the vaccine becomes available, you will need to be immunized.
Don't go too far, Dr. Wilkinson, because this next one is for you. Why do we need the vaccine if we are doing so well with other things like social distancing, the wearing of the mask, the pharmaceutical measures to avoid the virus? And B, if we get the vaccine, when can we do away with the mask and the social distancing?
Okay, so we've said before that this is a global pandemic caused by a very infectious agent, and the only way we can get out of this crisis is with a vaccine. And so yes, we can continue to social distance, wear the mask, etc., to avoid the spread and contain the virus, which is what we have been able to do here effectively so far. But I'm pretty certain that most of us would like to get back to some sense of normalcy. And until we have a vaccine to produce immunity and to arrest the spread of this disease, we would have to continue doing those things. Now, the question is, if we have a vaccine, can we do away with the things that you spoke about? We would not be able to do away with them right away. And most experts believe that if we get to a level of herd immunity across the globe, then we will only see some sense of normalcy, that is getting rid of the mask or the social distancing sometime late next year. And so for now, we need to continue doing what we know best to protect ourselves.
Dr. Wilkinson, what percentage of the population needs to get vaccinated to have herd immunity to COVID-19?
Okay, so just briefly, herd immunity is where a certain percentage of the population is immune either through infection or with a vaccine, such that if the disease comes in, because most persons are protected, it will not spread. And the few persons who are not vaccinated, they will be protected, since the virus will not be able to jump from the person who is immune to the person who is not immune to it. Now, the level that is needed for herd immunity varies from disease to disease. And so, for example, measles that we've studied for many years, the level for herd immunity is over 95%. COVID-19 disease is a very new disease, and we as yet do not know what is the exact figure required for herd immunity. What the COVAX facility is aiming to do, however, is to make sure that we can immunize 20% of the populations around the globe to get us initially out of the crisis, and then continue to immunize more and more persons so that we can eventually have herd immunity. So the 20% would not get us out of the pandemic, but will get us out of the crisis that we're in, where you see overwhelming of healthcare systems around the globe, etc., which is why the aim is to make sure that the frontline workers, those with pre-existing conditions, persons who would do badly if they get COVID-19, those persons you want to protect first, and hopefully within a few months of immunizing persons, we will get a fair idea as to what percentage actually is needed for herd immunity. So the jury is still out on the level. Thank you.
This question has to do with the suspicion of taking a vaccine. I am very suspicious of vaccines in general, and will not want myself or any member of my family taking this vaccine that appears rushed to produce. How safe is this vaccine, and what will you say to those of us who may not want to take it?
Prior to COVID-19, as I said, it took at least 5 years for the fastest vaccine to develop. And we can see that COVID-19 vaccine has come on board in less than 1 year. And I would not say that it was rushed, but this is a testament to the fact that we have new technology. We had a wide array of scientists from around the globe who were working on this, that we needed as a matter of urgency to get us out of this pandemic, and rigorous testing was done on the vaccine to ascertain the effectiveness of it. And so yes, I would say that the vaccine is very safe, and we are happy here in the Caribbean and here in St. Kitts that we can still sit back and look at it being used in first world countries prior to it getting here, but the vaccine is fairly safe. Not only the test results show that it was safe, but these vaccines were also examined by independent examiners who were separate from the persons who were producing the vaccine to ascertain that they were safe. And so I would recommend that once it's available, everyone who can get it should use it. Yes, these vaccines, because they're meant to mimic the infectious agent, when it is given, you would have some side effects, and the side effects, because this is a flu-like illness, you might have pain at the site of injection, you might have fever, headache, etc. But most studies have shown that these side effects last about 24 hours the most. And so when you're making your decision as to whether or not you will take this vaccine, you have to determine whether or not you will be trading inconveniencing yourself for 24 hours, or you're going to lose a lifetime. One has to understand too that what you do affects those around you. And so your decision to not take the vaccine will also affect those persons who are close to you, and the persons who are close to you physically are usually those persons who you love. And so what I would say to everyone is that yes, we can be assured that the vaccine is safe and efficacious, and so once it comes on board, you need to take it. And I remember when I was going to school and the nurses were coming to give what we call injectional vaccinations, they were always persons who were crying and afraid. And I remember I too was afraid, and my mother used to always tell me, toughen up and go and take the vaccine. So for those who don't want to take it, I said toughen up and go and take it.
Toughen up. We made a down payment to have the vaccine when it's available. It's now available. So how soon will we start using it here? And how will we decide who gets it first?
Yes, we made the down payment to ensure that we get the vaccine when it's available, and as soon as it's available via the World Health Organization and the Pan American Health Organization, we'll be getting our share to cover 20% of the population. You heard in the presentation that it should be available for the Caribbean region as early as March next year or maybe before. And how will we determine? The same way it's done scientifically around the world. We'll make sure that the frontline workers, healthcare workers get it first, and those who elderly pre-existing condition, because these are the ones who might suffer the greatest morbidity and mortality from COVID-19. And then the healthy, strong ones like Abdias and Superintendent, they will have to wait a while, including Leslie.
If you notice, a lot of our questions today are focused on the medical, and you can tell who is the only doctor in the room. The Prime Minister announced yesterday that he cancelled his New Year's ball. We have heard you, Dr. Laws, of course, and Dr. Wilkinson, characterize these events as super spreader events. While it is commendable that the Prime Minister is leading by example, will we see more proactive steps taken by the task force in cancelling some of these private super spreader events over the Christmas and Carnival season? Superintendent Henry.
Well, in my presentation, I did indicate that gatherings, permissions for events will be very limited, and the decisions to grant permission will be a risk-based approach. Yes, cancellation is always an option. I did mention that. Cancellation should always be an option, especially if the event is a non-essential event. And so we should always avoid crowds or crowded areas. And so we encourage persons who organize events to sit it out for this year until we are in a position when we could safely have large crowds. So for now, from the Commissioner's standpoint, permission for large events will be very limited, and we encourage persons who are organizing smaller events to consider postponing or canceling these events in the interest of public safety and public health.
There have been things circulating on social media about the country going into another lockdown come December, and also about bars and so on, restaurants closing at 10 p.m. Is there any truth to this, Mr. Samuel?
Mr. Williams, thank you for the question, and I'm glad that you have raised it. To date, we have not gotten any instructions, or there has not been any recommendations from the COVID-19 task force, neither from the NEOC, about having to close down the country. We investigated what was being circulated, and that was relative to Jamaica, and it was cropped and sent around stating that it was in St. Kitts and Nevis. St. Kitts and Nevis is not poised for any lockdown in the near future, and there has not been any recommendation for the lockdown of any bars. However, what I can say to you is that once there is a threat or risk in a particular area, consideration will be given to closing down those areas.
Thank you, Mr. Samuel, and thank you, Superintendent. We have another question, seventh question for the day. We have been hearing about these ships, you've been hearing about them a long time indeed, that are to come here for safe harboring for some time. What has been the holdup, and when will we see them in our shores? Mr. Samuel.
Thank you for that question, Mr. Williams. And yes, we have been doing risk communication in reference to these ships seeking to safe harbor in St. Kitts. The Rhapsody of the Seas and Grandeur of the Seas have been granted permission to safe harbor in St. Kitts for 60 days in the first instance. Rhapsody of the Seas is scheduled to arrive in St. Kitts on the 6th of December. The reason for the delay in their arrival was that the government or the cabinet decided, based on the recommendation by the National COVID-19 Task Force and other partners, that we should not accept the black sludge. And we recommended to them that if they wanted to safe harbor in St. Kitts, then they should find another destination where they can get rid of the black sludge, and then they can come to St. Kitts and Nevis. So that was the delay why they have not arrived in the Federation.
Thank you. Are the applications for vending and other permits via letter or forms to be completed? Superintendent.
Yes, for now, it would have to be via letter. You can send an email to Office of Commissioner at police.kn.
Thank you very much, and that basically brings us to the end of our questions for today. Thank you very much, Dr. Wilkinson, for answering so many of those questions, and to Mr. Samuel, of course, and Superintendent Henry. Before we end, I have an announcement to read from the Ministry of Sustainable Development, from the Department of Statistics. I've been made aware that some people are giving a lot of trouble just to say how many people live in their house and to give their contact numbers, things as simple as that. The Department of Statistics within the Ministry of Sustainable Development is seeking the assistance of the general public to lend support to field enumerators who will be conducting the pre-census listing and mapping exercise from November to December 2020. The pre-census listing and mapping exercise seek to collect data on the number of households and persons residing in the various communities and provide an update of the housing stock throughout St. Kitts and Nevis. The information is also important to aid in the planning process of the 2021 Population and Housing Census. In light of the above mentioned, the department will be grateful if you can, right. Okay. The department will be grateful if you can cooperate with them, because this is basically for your own good. I think we did something before on working for you. They were on, and the importance of having this information to help you and so on. So thank you for cooperating with the Ministry of Sustainable Development, the Department of Statistics. I want to thank ZIZ for their faithfulness in being here. Every time we have a briefing, and today we have Mr. Khalid Lake. Thank you, Mr. Lake. We thank Vesta Southwell always for her support and to be a member of the communications here at the NEOC. We wish Mrs. Christmas Jacobs a speedy recovery. We hope she gets better soon. She provides a very vital service at these briefings, that of providing sign language to a very special group in our community. Our Chief Medical Officer, she's normally here, she's not here today, and we thank Dr. Wilkinson. He's always here, but we thank him for his presentation and all those questions that he answered to give you a better understanding of where we are in terms of the vaccines and the COVID-19 management on a whole. Superintendent Henry, of course, who is also always here. It's almost like it's a second job for these people in uniform. And Mr. Abdia Samuel as well, who is the chairman of the COVID-19 National Task Force and the National Disaster Coordinator. And we thank all of you who continue to tune in every Wednesday. Once ago, you know, once upon a time it was every day. Now it is only Wednesday. We tune in. We also want to thank some hard-working people who are here at NEMA, and they're doing all of the data entry, making sure that the people who are coming, that they have the proper documents and all of that. Their work is very, very vital, and we want to say thanks to them. All the people, of course, who work at the airport, the people on the front line who, you know, are doing all of this work to ensure our health and safety. It is not easy, and we owe them really a debt of gratitude. Next week, we will be back for another COVID-19 weekly briefing Until then, I am Leswar Williams. Continue to take care.
Is on.